Welcome to the course demo for Biotility Current Good Manufacturing Practices for Dietary Supplements. The presenter is Harry W. Rambo from Thermo Fisher Scientific.
My name is Harry Rambo, and I am the instructor for this presentation. As you can see from this list, I have a diverse work history ranging from being a U.S. Army veteran, where I worked in primate veterinary care and behavior research, to working for 27 years in the tissue banking industry here in Florida. I attended colleges in California, New York State, and Florida, generally recognized as safe, or GRAS. As per the Federal Food, Drug, and Cosmetic Act, any substance that is intentionally added to food is considered to be a food additive. All food additives are subject to an extensive pre-market review before being approved for use by the Food and Drug Administration. However, this review requirement can be waived for substances that have been exempted from the definition of a food additive or have been granted GRAS designation. Regulators realized that it is impractical to compile an exhaustive list of all potential GRAS substances that can be added to food. For example, common food ingredients such as salt, pepper, vinegar, baking powder, or monosodium glutamate are considered safe when used as intended and accordingly are not listed among GRAS substances. Current Good Manufacturing Practices, or cGMP, is defined as a minimum requirement that a manufacturer must meet to assure that their products are consistently high in quality from batch to batch for their intended use. The main purpose of cGMP is always to prevent harm from occurring to the end users. cGMP is a system for ensuring that products are consistently produced and controlled according to quality standards. Current Good Manufacturing Practices, or cGMP, for dietary supplements is the FDA's regulation for the manufacturing, packaging, labeling, and/or holding operations of dietary supplements. This regulation focuses on the practices that ensure the dietary supplement's identity, purity, quality, strength, and composition. The FDA Guidance Documents. The FDA Guidance Documents are documents prepared by FDA staff, the regulated industry, and the public that describe the agency's interpretation of or policy on a regulatory issue. Guidance documents include, but are not limited to, documents that relate to the design, production, labeling, promotion, manufacturing, and testing of regulated products, the processing, content, and evaluation or approval of submissions, and the inspection and enforcement of policies. Guidance documents do not create or confer any rights for or on any person, and do not operate to bind the FDA or the public. An alternative approach may be used if such approach satisfies the requirements of the applicable statute, regulation, or both. A dietary supplement is a manufactured product intended to supplement the diet when taken by mouth as a pill, capsule, tablet, or liquid. A supplement can provide nutrients either extracted from food sources or synthetic, individually or in combination, in order to increase the quantity of their consumption. Dietary supplements must be clearly marked as a dietary supplement and may be found in many forms, such as tablets, capsules, soft gels, gel caps, liquids, powders, and nutrition bars. In the United States and Canada, dietary supplements are considered a subset of foods and are regulated. The European Commission has also established harmonized rules to help ensure that food supplements are safe and properly labeled. In the U.S., the dietary supplement industry had a 2015 value of $37 billion from 50,000 dietary supplement products. 50% of the American adult population consumes dietary supplements. Multivitamins are the most commonly used product. In the United States, it is against federal regulations for supplement manufacturers to claim that these products prevent or treat any disease. Companies can use structure-function wording if there is a substantiation of scientific evidence for a supplement providing a potential health effect. An example of this would be, this product helps maintain healthy joints. The label must bear a disclaimer that the Food and Drug Administration has not evaluated the claim and that the dietary supplement product is not intended to diagnose, treat, cure, or prevent any disease. The FDA enforces these regulations and also prohibits the sale of supplements and supplement ingredients that are dangerous or supplements not made according to standardized good manufacturing practices. A dietary ingredient is defined as a dietary substance for use by man to supplement the diet by increasing the total dietary intake. In order for an ingredient of a dietary supplement to be identified as a dietary ingredient, it must be made from one or any combination of the following substances: vitamins, minerals, herbs or other botanicals, or an amino acid. These dietary ingredients can be made into a concentrate, metabolite, constituent, extract, or any combination. The Federal Food, Drug, and Cosmetic Act requires that manufacturers and distributors who wish to market dietary supplements that contain new dietary ingredients notify the FDA about these ingredients. Generally, the notification must include information that is the basis on which the manufacturer or distributor has concluded that a dietary supplement containing a new dietary ingredient will be reasonably expected to be safe under the conditions of use recommended or suggested in the labeling.
Here is a knowledge check question. True or false? Dietary supplements are a manufactured product intended to supplement the diet when ingested orally, taken by mouth. Is this statement true or is it false? The question is true or false. Dietary supplements are a manufactured product intended to supplement the diet when ingested orally, taken by mouth, and the correct answer is true. Remember, a dietary supplement is a manufactured product that is intended to supplement the diet when taken by mouth, and dietary supplements are a subset of foods regulated by FDA.